First of all, this event is part of National Drug Facts Week, and we'd like to thank our partners, NIDA, for providing a good portion of the information here today and for helping to promote our webinar on their website. Now I'd like to introduce the members of today's panel. Dr. Phil Newcomb is a South Florida-based pediatrician in private practice since 1990. He's a partner at Physicians to Children in Coral Gables. He is past president of the Greater Miami Pediatric Society and currently serves on the board at the Miami Children's Hospital. Welcome, Dr. Newcomb. Our next panelist is David Vittoria. David has been dedicated to addiction treatment, recovery, advocacy, and prevention on the local, domestic, and international levels for over 20 years. He's currently the Assistant Vice President of the Addiction Treatment and Recovery Center at South Miami Hospital. David is a Miami native, a husband, and a father, and has been member of our Board of Trustees since 2012. Welcome, David Vittoria. Our third panelist, who you don't see at the moment, but you will see later on in the program, is Melinda Rodriguez, an Informed Families Ambassador and a 5th grade reading and language arts teacher at Sunset Park Elementary School in Kendall, Florida. Melinda has been educating students at Sunset Park for the last 10 years. She received her BS in elementary education and graduated magna cum laude from Florida International University. Welcome, Melinda. And last but certainly not least, I would like to introduce Peggy Sapp. Peggy is President and CEO of Informed Families and Volunteer President of the National Family Partnership. She has over 30 years of experience in the prevention field at the local, state, and national level and has served on the advisory councils of the White House Office of National Drug Control Policy, the National Institute of Drug Abuse, and the Florida Governor's Office of Drug Control. Please join me in welcoming Peggy Sapp.
Welcome to all of you, and welcome to all of you. Thank you for coming. Amy didn't say that Phil also is a father, and I've known Phil since he was a little boy, so this is all very interesting. Life just keeps coming around and goes too fast. But welcome to all of you out there across America. We're delighted that you're with us because we need your help to get out the message. And so we're going to just start right off. What is prescription drug abuse?
Sure. So what an important question, huh? What is prescription drug abuse? And I can tell you, working at the Addiction Treatment and Recovery Center, this is a question we get often. We get about 2 calls a day from parents, concerned teachers, and other people in the community that are asking this very question. So very simply put, prescription drug abuse is taking any kind of prescription medication in a way that it is not intended. So taking it without a prescription, taking somebody else's medication, taking that prescription medication in order to get high. Clinically, there are other criteria that we go by at the Addiction Treatment and Recovery Center, but that puts it pretty simply. And next, we'll talk about some latest statistics. Every day in the United States, an average of 2,000 teenagers begin using prescription medications. And you know, I thought about this morning. That's 83 teenagers an hour. Right? I got up at 5 o'clock this morning for a run. About 7 hours have gone by my count. That's almost 500 teenagers that have begun abusing prescription medication just since this morning. An absolutely startling statistic. And to give you some more statistics that are sure to encourage a lot of us to get involved in this very important topic. First of all, 14% of high school seniors report that they have abused a prescription drug in the past year. I mean, a phenomenally high number, that according to the Monitoring the Future study. Prescription drugs, the most commonly abused substances, age 14 and older are using that only tertiary to alcohol and marijuana use. And every day, 62 Americans, talking about startling statistics, die of a prescription drug overdose.
Yeah. You know, what drives drug use? I think for me, spending 30 years in this, the 2 statements that simplify it and take it right down to the heart of the matter: availability. People use substances that are available. Certainly prescription drugs are in your medicine cabinet. They're everywhere. They're in your purse. And this one is a big one. If you do not perceive a drug to be harmful, you will use it. So when we're talking about the message that the media sends out, it's very important what that message is, because if you don't think it's harmful, you'll use it. And certainly prescription drug, we trust our doctors. We think that, it must be safe. Or I don't know that we trust big pharma, maybe, but we do think doctors tell us the right things. So David, what's the reason for the abuse?
Yeah, sure. Very good question, and also a common question we get from parents and other folks asking us, why is my son or daughter abusing this medication? So first and foremost, what we hear most often and see most often, to get high, to change how they're feeling or how they're thinking, to counter anxiety or sleep problems. And some of these reasons differ with boys and with girls. We'll often come across young men, teenagers, who are using anxiolytics or using pain medication for different reasons than girls. Girls most often for weight loss or to relieve stress. Another common reason for abuse, to boost academic performance. And a little bit later we'll talk about some of the study drugs like Ritalin and Adderall and how those are used to help treat pain. Oftentimes pain medications are abused to stay alert, which we see at the Addiction Treatment and Recovery Center with our kids in school and even teenagers and young adults, and to lose weight.
I identify with that.
You're probably doing it safely, though, and you look fine.
I'm not using any. That's why I'm not. No, I'm sorry.
Yeah, well, and to talk more about the most commonly abused drugs, first and foremost, painkillers. That's at the top of the list with the children. And yes, children. We're talking about children as young as 14 years old that come to us for help. Painkillers such as OxyContin, Vicodin. Those are the most commonly abused painkillers that we see. Central nervous system depressants, benzodiazepines like Valium and Xanax. The vast majority of kids that are coming to us for help are using Xanax, and specifically Xanibars. So this is 4 Xanax pills that are all attached to each other at a half a milligram each. So for a total of 2 milligrams of Xanax, and at least 3 to 4 times a week, we're getting a child come in that has begun abusing Xanax. And where do they typically find that Xanax, if not on the street or from a friend, perhaps from their parents' medicine cabinet or from a family member?
That's amazing. Well, this next slide Amy gave to me, and when she gave it to me, I said, really, I have to look at that slide. Is that really right? Because the media, one of my first reactions from more than one doctor, that's only 1.8%. Yet doctor shopping is the first thing I thought, oh, well, that can't be right. Because the media, I want to keep saying this, the media distorts the reality. And the reality is they're getting them free from your medicine cabinet and your relatives. They're not buying it from their friends. They're getting it free. So part of our problem, I've decided after working on this program for 8 years, is that we don't believe the statistics. We really don't believe it. And here's why, okay, folks, this is why we don't believe it. Because we don't want to believe it. Because if we believe it, what does that mean? It means I have to do something. You're not going to fix it for me. You're not going to fix it for me. Teacher's not going to fix it. Every person, every parent has to do something. Well, who wants to hear that? I mean, we're really busy today. So we can go back to this, or we'll send you a copy of this. But at first, I did challenge Amy, because even being in this field, I thought, well, surely it's doctor shopping. Okay. So, Phil, now we're up to you. Science and drug abuse.
Well, Peggy, it's a challenge. And I think probably before I go into some of the findings, it behooves us as parents that we've got to be vigilant. As David was mentioning before, experimentation starts early. Average age 13 for prescription drugs, and we just have to keep our eye on the ball with our kids. The availability of it makes it such a challenge in the times we live. But as a pediatrician, you're looking for, I want to say this the right way, but you're looking for problems. They come for a visit, and suddenly there are problems at school. And you're looking for trends, not just a rough semester where we may have overreached with some of our curriculum, but you're looking for a trend in school performance. You're looking for problems at home that hadn't been there before, and something is persistent. Troubles with friends, and sadly, and it happens with the best of families, trouble with the law. As David knows very well, with abuse, our children become susceptible to things we didn't dream for them. Criminal activity, accidents, involvement in things like this. And so when things like this come to our office, it's a sign that something is at play, and many times it's abuse of drugs. Looking for specific physical signs is also a challenge because we are talking about teens. And so there's a lot of overlap. But I think what you're really looking for as a parent is an accumulation or a cumulative signs and changes that just aren't really apparent, not an easy explanation. So you see your kids who you had family dinner with, and now they're withdrawn. They're in the room more than is what we would think acceptable for a teen. They're withdrawn. Maybe it's the flip side. Maybe they have an excessively high mood. We love to be talkative, but excessive talkativeness may be a sign. Weight loss, as David was mentioning as well. So you're looking for sort of a total picture and a change.
Okay. Amy has scripted us. We have to go, oh, what is your role? Role of the pediatrician. We stay on task.
Yeah. Well, there's a tension these days when practicing medicine, and we all try to do our best in any field. David's field, teaching, Peggy with what you do, and that is doing what we're supposed to do, what we're trained to do, and yet giving it the time. There's a tension between providing care and having time to visit enough to see whether or not there is a change. So going beyond the examination, which is important, the blood pressure, the vitals, the labs, something that can occur with primary care docs, and I'm talking about family practitioners, pediatricians, if we're able to battle the flow of patients, is that year after year, by nature, you see these families again, and you see the kids. And as we were talking about how fast time goes, these little ones who are in diapers, next thing you know, they're in middle school. And over time, there's an opportunity, if it's nurtured and done in a way that's real and authentic and non-judgmental, there's a chance to develop a relationship with these kids. So the parents know when a problem occurs or they sense that there's a problem, there's someone else that they could think of to turn to. We've heard that it's a village.
Absolutely.
It takes a village. Well,
Absolutely.
there's an opportunity for the primary care docs to be a voice in that village. And leading into that, before a problem arises, and there's a call, and we see this in our practices, the folks will call, and God willing, if we've done a good job, the kids are willing to talk to us. But before we get to that place, in a way, again, that I say is non-judgmental, a sense that the kids know you're on their side, that there's anticipatory guidance that can be given. And in a way, at the end of a routine visit, just a kind of a attaboy, go get you, being mindful of the friends you keep, how important that is, the peer pressure that's on all of us as adults, but particularly the kids wanting to fit in, as David was, and you were visiting about Peggy, and beyond that, not that everybody's doing it. You mentioned that the media, as a way, we know we have a real problem.
Yes.
But it almost is enough to make you turn off the television when you see the way it's projected to us. But we have to deal with it, and a sense that you're not alone in this. Not everyone's doing it, and we're on your side to try and help. These kind of messages, year after year, I think have a chance to sink in if you're authentic and if you're real with the kids.
I think that's true. And one of the things, Phil, I want to talk about is like what you say to the parents, because I've been thinking about this about we've been working on this campaign since 2008. Well, it's a pretty common sense campaign. So why aren't people getting some of it? And here's what I've been thinking. I'm running this by you. I think somewhere along the line, we stopped telling our 2-year-old, don't go in someone else's things. That is not yours. You do not do this. Why would someone go in someone's medicine cabinet? That's been enough of a surprise for me. I really am showing you how old I am. I mean, but we're missing those messages along the way. And so now when you tell your child, don't go in someone's medicine cabinet, they haven't been hearing that since they were growing up.
That's right, Peggy. Well, I have, if you were nice to mention, I have 3 little ones at home. And so I got to practice what I preach in the office, and I'd like to think it's more than just talk, but you really learn when you're at home and raising your kids. And at the risk of sounding a bit old-fashioned, in addition to being vigilant, there's got to be some limit setting and accountability for these kids. And we got to be consistent in that. And there's no better place to start than at home, where the problem
really
shows
starts.
itself.
Yeah. So I guess we want to encourage you, parents out there, to really join with us and realize people say, well, I just want to get the message and get the message. The message is something you're delivering every day. All by the way you act, by what you say. It's a little bit tiring. Being a parent is tiring. I mean, they're going to get you. So we put together the Lock Your Meds campaign. We created it in 2008, and it's to educate and prevent this whole epidemic. Now, secure your medications. That's another thing. People say, well, how do you secure your medications? So we have some ideas from David.
Yeah, sure. And before I get into those ideas and do a little demonstration here, I just want to add to something that you mentioned, Dr. Newcomb. When we look at the positive outcomes that we've achieved with thousands of teenagers over the years at the treatment center, a couple of things really stand out. Number one, and I think you are a wonderful example of this, the kids and the families who have connected with a pediatrician are more likely to be the families, and those are more likely to be children that get the message sooner and able to integrate that message and lead happier, healthier, more productive lives. So I just want to emphasize the role of a caring, competent, engaged pediatrician such as yourself in those positive outcomes we see with kids. And also, again, to further your point, it is about making a meaningful connection with kids and with families, and doing so in a non-judgmental and a very sincere, genuine way. So I just wanted to echo that. We certainly see every day how important those connection points are. So securing your medication, number one, speaking of a common sense solution, right? But one that's unfortunately not often taken. Keep your medications out of reach. Keep your medications out of reach. Make sure that you pass the message on to other people in your family, that when your children or anybody in your family that's of young age goes over to a family member's house, that those medications are also locked up at those houses as well. And we have various locking mechanisms to show you. A couple of them are on display here. I don't want to look like QVC, so I'll just leave them there on the table. You can get more information, though, at the Informed Families website on some of those safe ways to be able to secure your medication. Now, Peggy's going to talk about step 2.
Yes, so
Well,
if
before
you
she does that, Dr. Newcomb, I think, was going to share a little bit of information about some other concerns, and I just want to make sure, some of the concerns about overprescribing and
overprescribing,
combining
combining medicines.
Thank you. Amy.
Okay.
Peggy?
No, you please go ahead. You're the
Well, talking about where this starts and accountability, it starts with me. It starts with us. And the drumbeat of this conversation is the availability of these prescribed medicines at home. And as a prescriber, we need to be careful that we are prescribing in a way that follows acceptable guidelines, evidence-based guidelines. It's a sensitive subject, and I want to be careful as I address it, but one of the topics that comes to mind in this regard are the stimulant medications. And David made a comment about this a little bit ago, for a very real diagnosis and a challenge for families, and a very real source of effective treatment, I might add. So I want to be careful before I say anything else that there is pharmacotherapy that is effective for attention deficit, and for those families that have the challenge and blessing of a child this way, and who are exhausting all of their forms of therapy. Medication can be a real terrific, if I can say it that way, adjunct benefit. But having that on the table, one of the realities that we all know at this table here is that just over the past less than a decade, the diagnosis of attention deficit has skyrocketed. Depending on the statistics you read, about 6.5 million children carry this diagnosis now. And when you overlay that number, these other numbers are still very impressive. And in that period of time, the rate or amount of stimulant medications have increased prescription, over 130% for the amphetamine products, and over 50% for the methylphenidate or Ritalin products. And those are staggering numbers, and it speaks to availability and access at home. But I contrast that, and again, starting with myself, some studies have shown recently that we know as an evidence-based approach, particularly for the younger school-age kids, the first line of treatment is behavioral management, behavioral therapy. But what we're seeing is that physicians, more often than not, are prescribing medicine as a first-line treatment. And kind of a sad corollary to that is that over this period of time, data from the National Poison Control has shown a 75% increase in calls related to abuse and ingestion of stimulant medication. So we just have to be careful how we prescribe, careful follow-up. But again, it goes towards what David and Peggy, you were talking about, blocking that medicine cabinet.
Do you find that the parents push you for the medications?
That's another visit for informed families. Will take a while. I mean, everyone wants to see their children do well. And let me back up and say, more importantly than that, they want their children to be happy and adjusted. And I really think there are stresses in academic performance, but when you get in a room and visit with families, they want to be happy. They want them to meet their God-given potential. They all have their gifts and strengths, and when you have a chance to really frame the conversation that way, because none of us is immune to the pressures, the kids, and the successes that are put upon them, and that has a ripple effect, as you know, towards one of the reasons why we're seeing kids reach out for these medicines. We know that the kids want them. There is a thought, David again was alluding to, about the thought or impression that if I can just get my hands on this medicine, whether or not I've got the diagnosis of ADD or ADHD, I'm going to do better. And there are studies that support that there's some temporary, and David, you know this, but there's temporary benefit. I want to use that word carefully in terms of increased wakefulness, increased focus. But really, other studies that follow that show that when there's really abuse of stimulant medications, ultimately your GPAs decrease. Not to mention the side effects, Amy, with what can come with abuse of these medicines.
So I think that's a fascinating conversation, because it's fads. I mean, did we always have this many people with ADD, or do diagnoses go in fads, do you think? I mean,
I don't think it's a simple question to answer. I think in some ways, the way that kids are looking for prescription medications, whether it's stress, whether it's anxiety, comorbid findings, depression, there's some overlap specifically with these attentional medications. And the word needs to go out, as I'm so grateful for this conversation today, that just because they're prescribed doesn't make them less potentially dangerous or abuse. The abuse potential is there. So they can hurt in the right patient, monitored the right way, they can be a great benefit. But outside of that prescription use, they can be a source of trouble.
Well, one of the things that we want to talk to you about is how to take regular inventory of your medicines. Do you even know what's in your house? And this is going back to, this isn't high tech. We just have a simple home medicine inventory card that you could download, and it just asks you to list your medicines. Do you even know what's in your house? I find that we don't. You need to go to the dentist and they give you 30 pills for some toothache or something. You know, so that gets back to how you dispose of them. And we'll do that in a minute. But we find just something as simple as the inventory card as your reminder, list them, and then go back once a month to know what's going on there. Remember, we did this before with the alcohol, and it's something you need to do to protect your children. But when you find yourself with old medications in the cabinet, what are you supposed to do, David?
Right, and by the way, a quick comment on that inventory. I absolutely love that tool. Over 20 years in this field, I have never seen such a simple and effective tool as keeping track of your medicines. And so I'm happy to say that I've already downloaded it from the website, and will undoubtedly pass that along to the parents. And on that note, again, to further up an important message that Dr. Newcomb shared. 3 years ago, when I came aboard at Baptist Health with the Addiction Treatment and Recovery Center, the average age of our patients was 46 years old. So the average patient in our program was age 46. Today, it's 26.
Mm-hmm.
So the average age has gone down by 20 years. You're talking about 3 years. Talking about 3 years, the average age of a patient coming to us for help has dropped by 20 years. And the vast majority of those young adults are reporting that they are using prescription medication, oftentimes medication that they might have first been put on for a real diagnosis, something, you know, that a physician with all good intentions and all the right reasons prescribed that individual. And when we drill down a little deeper, just to further the importance of this message, and we talk to those young adults that are in college, whether they're going to FIU, UM, Barry, St. Thomas, and we see a lot of them, they, at one point in their younger years, middle school, high school, began taking medication from a family member, from their medicine cabinet, from someone that they knew. So not only are we seeing a high incidence of abuse of prescription medication, but a correlation between that abuse of potential and experimenting with somebody else's prescription medication early on. So I just wanted to add to that point. So disposing of unused meds. First of all, always keep that inventory and check and see if you have any unused or expired medications. And one thing to draw your attention to is go to the Informed Families website often, and you'll see dates listed for take-back programs. You'll hear some information in the media and whatnot about what the FDA might suggest, and you know, we won't get into a debate about that because I have some of those thoughts, but that'll be for another webinar. But keep track of those take-back program dates and keep track of your unused and expired medications.
And household trash. Now, folks, I got this right out of the National Office of Drug Policy when I was on the advisory board. The way you do this is you mix the drugs with either kitty litter, coffee grounds, or something like this. And so everything in the world is not high tech. It just is common sense. You mix it up. Cat litter is a wonderful thing. Coffee grounds, and that's how you dispose of them if you're going to dispose of them. So now we're going to introduce you to Melinda, who is a teacher and who is just fabulous, and she helps us spread our message. And so welcome, Melinda, and we'll let you tell us about how our things have helped you or not helped you, or whatever you want to say.
Excellent. As you all know, I'm a teacher at Sunset Park Elementary. I've been teaching for 10 years, and going hand in hand and what we've been discussing, at the elementary level, I do work with a lot of children who have been diagnosed with either ADD or ADHD and have been prescribed medication for that. And over the course of 10 years, I've seen that it works wonders for some children. They've exhausted all their resources, and it's come down to medication, and it has worked in the student's benefit. And then I actually get visited by these children when they're now in middle school and high school, and it's such a great feeling to hear from their parents that they've started to wean them off. And I even have this one boy that I've seen, he's now in high school, and he's completely off the medicine. So I think if we do find that we've exhausted all resources and medication is one resort, that should be the end goal for our children, that we eventually wean them off of that and give them other coping skills to help them deal with their attention deficit. At the elementary level, I don't see that too often. Usually through the course of elementary, they do stay on the meds. And then I've seen the contrary where it doesn't do any difference. And then we have to look at something else. As far as the bigger picture of spreading the message, before I joined Informed Families as an ambassador, we've always had that message. Thinking back years ago, just say no. That's what comes to mind, just say no. And I know that all my years, that's what I tried to preach to my students. You know, no, say no against drugs. And through this organization, I like the way that we've divvied it up between Red Ribbon Week and now the Lock Your Meds, because that's a whole other realm that parents, teachers, students alike may not realize, wait, I know these kinds of drugs, marijuana, alcohol, but now there's these kinds that were either prescribed to my parents or prescribed to me myself. And I think that's another way to address how we need to go ahead with caution with anything that we are ingesting and consuming in our bodies.
Well, and I think it's about, there's not one little lecture that's going to save everybody. And if that's one thing I see people coming to us for, and I just want to tell you, it's not there. It's about delivering the message from different people in different ways so someone can hear it. And, you know, everybody has to get involved in this and hear it on some level. And so I'm going to talk to you about 7 messengers, and that is, well, take the pledge in our kit, and Melinda, you have the kit, and you've used the kit. We have a toolkit for each campaign we do, and the kit contains like these posters, and we have them in one of everything. If I have a girl and you say, do we have a boy? Yes, we have a boy. Do we have a this? Do we have that? We have one of everything. So you can identify with the person who's on the poster. But what else is in the kit, and what have you found helpful? The pledge? I mean, we're always
The kit is very comprehensive. I personally, again, being a first-year ambassador, it's helped me tremendously carry out the campaigns. In the kit, we do offer a newsletter to communicate with the parents. So at my school personally, we have a school website. We post that on the school website. So every time you log on, you see that first thing. It informs families on whatever campaign we're working on. We also, at the school level, I do disseminate an email to my faculty and staff so that they can also help me in spreading the word, because I'm just in my classroom, in my 5th grade classroom, and there's so many children that I reach through this campaign. So when I get my assistant principal on board, every morning announcements, and she's spreading the message. When I get my counselor, when she's doing her classroom guidance, and she's spreading the message. And then in art, they're making their posters, and then in music, and they're right there in the school, they're getting their 7 people. They're hearing it at least 7 times in school. And then it goes back to the parent pledge cards, the student pledge cards. So they definitely get drilled at school, at least at my school, I know that for sure.
And I'm glad that you like the kit, because every now and then, you know, we're like putting all this together, So hearing it from you and that it's useful. And again, it's about spreading the message. It's not keeping it. You're not the expert. You're just passing on the message. And here are some of the posters that are in there. There's the girl, 2 girls, I guess. And then we have the boys. And I love some of the lines. This is on the boy. Can we go to the boy? He gets his music online, his T-shirt at the mall, and his drugs from his mother's purse. Believe me, I got a few phone calls on that. You know, but it's true. I mean, it's just in fact a case. So we try to tell, and here's the next one. We try to give you accurate information in a way that people can hear it. And you know, I never thought that we are in Walmart, by the way, with our little medicine cabinets and our little pouches. But that's another way to deliver the message. And think about it. What do we do in today's society? We buy things. We'll go out and buy this. This will help you. That because we tend to think we can buy our way out of something. Well, there are little things you can do to lock up your medications that aren't all that hard and also help you pass the message. And we'd really like to acknowledge Publix. Publix pharmacies, 900 of them throughout the Southeast, are displaying all of our posters. So we are really grateful to Publix for doing that. And people are coming to us and asking questions for the next thing. Now, here's one thing I want you to do. Are we going to the seven messengers? Here's our 7 messengers. We don't know where our 7 messengers are. We have another handout that's equally as effective as our medicine today. Here's what I want each of you to do if you're watching this or you hear this. I want you to decide who are the 7 messengers who are going to deliver this message to your child. Is it your, I don't know who it is. Is it your neighbor? Is it your pediatrician? Is it your teacher? Is it your grandmother? I want you to write that down. There is nothing like, I don't even think you should do it in the computer. Do it by hand. Write it down. That does something with your brain. It reinforces it. And so, therefore, you've now gotten these people, you've educated them. Then you say, oh, here's what you say. You say, well, I don't know what I should tell them. Then you come to the Informed Families website, we'll give you a kit. The kit tells you what to say. That's all you have to say. But here's the big thing. Don't try to tell them all at once. Because I think, like Melinda, just spreads it out a little bit at a time. Because if you try to tell them all at once, they don't listen. And now here's another thing that we've developed. Here's a little heart pen. If your 7 messenger people have delivered the message, then they can wear their little heart. Now, what does that keep doing? You don't have to, as a mother or as a father, keep saying, "Dr. Meds, Dr. Meds." You're wearing the message, which is role modeling, which is what we do. And we have a special on today. We just figured out this morning. We'll send you 7 of these for $14. Now, what a deal that is. I mean, we just figured this out this morning. Now, as you give the message, you can give the little pin, and it's a very powerful thing to keep reinforcing that message. So that's the 7 things. We do have the card, we just don't know where it is. It's not there yet, but it will be on the website. You can download it. You can do your 7 messages.
We'll send it by email.
We'll send it by email to you. So now we're at the end of this, Amy, or how much can we just take Q&A, or what do you want us to do?
Yeah, well, first we definitely want to thank NIDA and National Drug Facts Week for being partners on this webinar, and of course Baptist Health South Florida, our longtime donors and partners, all of our presenters. We're not going anywhere. First we're going to do the post test, and then we will answer anybody's questions. So please enter your questions in the question section or in the chat section on your screen. We'll be looking out for those. Okay, let's move on to our first question. The first question is for Peggy. How can I become an ambassador?
That's easy. Go to our website and sign up. And once you sign up, we'll lead you through a tutorial. And they're 3 minutes. David's been on those. We only have a few minutes, folks. So all of our training modules are now 3 minutes. So that is refreshing to know. And you don't have to do all 4. I think there are 4 modules, Sergio. 4.
Yes.
4. You don't have to do all 4 at once, because who has 12 minutes? You can do 4 at 3 minutes each. So just go to the website, and we would love to have you as an ambassador.
Okay, the next question is for David Vittoria. How do I know if it's time to get help for my child?
Boy, a great question and a common one. I think Dr. Newcomb covered all of those things that we as parents want to look for, we as loved ones. We don't just have to be a physician to look out for those things. First of all, any changes in one's physical appearance. And again, as Dr. Newcomb mentioned, we are talking about teenagers and children. So not any one of these things is like a game changer, but you want to look for a pattern of behavior, a trend, if you will. So behavior is one of those things. Unusual behavior, more isolated behavior. Look for changes in their friends. I'm not talking about just adding new friends or joining a baseball team and meeting other people, but a change in their friends combined with a change in their behavior, maybe more isolation, change in their physical appearance. Look at their grades. Those are some really important things to look out for. And again, when we talk about the families that come to us, these are the things that they report: grade changes, behavior changes, those kind of physical changes to look out for. Those are the important ones.
Okay, thank you. And the next question, this one is probably for Peggy. How can you help your kids hang out with the right friends?
Well, that's a big question, isn't it? You have to, I think, be an active parent and sort of identify who the right kids are. And what is it that your child is really good at? Is your child really great at art? Well, then that's what you want to encourage, and you want to encourage them to do what they love to do. I think that's more effective than following some pattern. If the pattern at your school is, I don't know, soccer, and your child is terrible at that, don't push that. Push the art if they're great at art. it's knowing your child and then helping your child find those kind of friends and getting them involved in something.
Okay, and the next question is, how do I obtain a home medicine inventory card?
Go online and download it. Isn't it wonderful? We say today we have high tech and high touch. You know, the high tech is great, but there's nothing like just a piece of paper and a pencil. So go online and download it.
Well, that is our last question. We want to thank so much all of our panelists. We really appreciate you taking the time today, and you all did a wonderful job. Want to thank everybody for attending our webinar. We'll be sending you a survey shortly, and once you complete the survey, we will send you a link to a certificate of attendance and anything else that we've promised you. Thank you again for your participation, and we're so glad to have you with us today. Goodbye, everyone.
Thank you.